Hi, I'm Al.
And I'm Kat.
We're Chicago Gray Panthers.
And we're also single-payer activists. And for the past 7 years, we've had the great honor of filming another Gray Panther here in Chicago, Dr. Quentin Young.
And if that name isn't familiar to you, Dr. Young co-founded Physicians for a National Health Program. They're the largest physician single-payer organization in the country.
And he also served as personal physician to the likes of Dr. Martin Luther King, the great Chicago writer Studs Terkel, and he also served in Chicago Mayor Harold Washington's administration.
Quentin is a lifelong public health advocate. He serves at Cook County Hospital. He fights hard to keep the doors open when a lot of powerful types want to shut it down. And he's also instrumental in getting a new public hospital built in Chicago.
And he also organized a group of doctors to travel to the South to treat civil rights workers in the 60s.
In fact, when Dr. King was injured by an object thrown from the crowd at a march in Chicago, Quentin was the man who treated him.
Quentin has been a Gray Panther for a long time. In fact, he celebrated his 90th birthday recently. And we're very proud to be a part of this convention. And we're very proud to introduce to you Dr. Quentin Young.
I'm Quentin Young, a longtime member of the Gray Panthers and a supporter of their good works. Well, like the Gray Panthers, I'm old. And I think what's happened in the last decade is recognition that seniors can not only be important, they can be vital to a developing system. And I'm very hopeful that the new invigoration of the single-payer movement by Gray Panthers will make a big difference in the speed with which we achieve a decent health system.
Quentin has really helped to ensure in this country not only the health of individuals, but the health of the country.
Maggie KUHN, indeed, she was a remarkable person, one of the most remarkable I met in my life. As she aged, she just got better and better and was the backbone of the single-payer effort of the Gray Panthers, which was substantial. It was a big mistake asking Maggie KUHN to retire. She had all the know-how of 60 years of life, and she was a very vital leader. And the organization flourished under her leadership. It went backward, I think it's fair to say, after she passed, because there was no successor to her. But now, for the last 2 or 3 years at least, the organization is showing really important signs of life and vigor, and I think it means a great deal to this movement that has to be met. And I'm looking forward to working with them.
Hi, I'm State Representative Mary Flowers, and it's been my pleasure to be the chief sponsor of the single-payer health care bill for the state of Illinois. And it has also been my pleasure to work very closely with our favorite doctor who makes house calls, Dr. Quentin Young.
Well, we solved the problem for seniors with the Medicare. That is to say, over 65, you get government-assured insurance and a really important protection to elderly people. But everybody else is vulnerable, some of them desperately vulnerable. People, young people with no real job to allow them to buy insurance. So this is a very pivotal event in American social and medical life. And the Gray Panthers play a particularly important role in bringing the senior group in support of the younger people. Well, they're obvious and they're enormous. And it's very good that the seniors are making an effort to reach out to the younger people because it affects people at all age groups, although the demands are different at different ages. I think the revitalization of the Gray Panthers is a very important development and will play a big role in achieving single payer for this country. You realize this is America, U.S., the United States, is the only advanced country that hasn't adopted some variation of single payer. And it's costing us dear. The economic hardships can be traced directly to the failure to enact a single payer system. So the stakes are high. And indeed, the very future of this country is at stake. And we have to work hard to make it happen. and we can hope for something better soon. Not tomorrow, but 6, 12 months. Next election, we may see important changes. Well, to me, their biggest task is to reach out to younger people who are not covered and who are at great risk, and build a coalition between seniors and younger people as we go forward. We're the only developed country in the world that doesn't have, in essence, a single-payer response to the need. And we've got to change that, or we'll have a very, very bad situation. And having young people around me is friendly, is important. And it's made my life more interesting, and I hope made my utility to the movement more.
You will not meet somebody with a more clear-eyed analysis of what's going on nationally or internationally in regards to the world and what can be done about it, and with a completely unwavering belief that people are the most powerful element in changing their world. Some people would say that this is like an unflappable optimism, but I think you're right. I agree. I've adopted it.
Way back, we spontaneously hit on a slogan which has some muscle behind it, and it is, everybody in, nobody out. Single payer is the answer. We have a slogan which I want to work on you now, and I demand your compliance. We say everybody in, nobody out. Let's hear it. Everybody in, nobody out. 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 You see, you feel better already.
So what is the right age to be active? What is the right age to change the world?
About 103. You knew that was coming.